ever stop and think about what's happening inside your own bones? I mean, really think about it, because it's not just a boring old frame for your body. Nope, it's one of the most advanced factories on the planet, and it's constantly building your blood. So let's dive right in and meet the all-star team that keeps you up and running. Just imagine that for a second. What if we had a control panel, and we could just tell that factory, hey, we're running low on oxygen carriers, let's make some more, or we need immune defenders, and we need them now. It honestly sounds like something straight out of science fiction, right? Well, we're getting way closer than you might think. And the key is a set of signals our body uses called hematopoietic growth factors. Now, this whole amazing process has a name: hematopoiesis. It's a constant 24/7 manufacturing line running deep inside your bone marrow. Every single blood cell you have, the red ones, the white ones, the platelets, they all get their start right here in this incredible high-stakes factory.
Okay, so let's meet the first crew on the factory floor. This is the team that's responsible for your red blood cells. You can think of them as the oxygen carriers, the delivery fleet that brings fuel and energy to literally every part of your body. When their numbers get low, that's a condition called anemia. It can leave you feeling totally exhausted.
So how do we help this team out when they're struggling? Well, we can use something called erythropoietin, or EPO for short. EPO is basically the foreman on the job site, shouting, "Speed up the production line," to churn out more red blood cells. But you can't build cars without steel, right? That's where iron supplements come in. They're the essential raw material. And to make sure every cell is built perfectly, you need the specialists, vitamin B12 and folic acid. They're absolutely crucial for the cell's DNA and making sure they mature correctly. You know, sometimes the problem isn't just about the number of cells, but their quality. In sickle cell anemia, for instance, we use a really unique approach. Instead of just cranking out more cells, the drug hydroxyurea tells the factory to switch production to an older model, fetal hemoglobin. See, this type of hemoglobin doesn't have that sickle shape, which lets blood flow way more smoothly and helps prevent the terrible pain that comes with the disease.
But, and this is a big but, pushing this production line hard has its own risks. When you make more red blood cells, you're essentially making the blood thicker, and that can lead to things like high blood pressure and, more seriously, a much higher risk of blood clots. Even the raw materials, like iron, can cause some pretty unpleasant side effects like nausea and constipation.
All right, next up, let's talk about the factory's security and defense force. This team is in charge of your white blood cells. They're the defenders that fight off all kinds of infections. Now, after something like chemotherapy, this team can get really depleted, which leaves a person incredibly vulnerable. So, how do we call in the reinforcements? We've got two main signals we can use. The first is G-CSF. Think of this as calling in the special ops. It specifically and very quickly boosts the production of neutrophils, which are our #1 frontline infection fighters. The other option is a generalist, GM-CSF. It boosts not only neutrophils but also other cells like monocytes, giving you a much broader immune response.
Of course, ramping up production that fast puts a huge strain on the factory, and the side effects really show that. The most common one is bone pain, which, well, it makes perfect sense, right? That's the factory itself aching because it's been kicked into overdrive. Fever and flu-like symptoms are also really common, as that whole immune system just gets fired up.
And last but definitely not least, we have the third critical team, the factory's rapid response repair crew. This is your platelets, the tiny little cell fragments that literally rush to the scene of an injury to plug leaks and stop you from bleeding.
To give this crew a boost, we use drugs called TPO agonists. They act like the lead engineers, telling the bone marrow to build more of these giant cells called megakaryocytes. These huge cells then break apart, releasing thousands and thousands of platelets into the bloodstream. And this is a total game changer for people with conditions like ITP, where their own body is actually attacking and destroying their platelets. Naturally, stimulating this crew comes with its own set of potential problems. Some of these drugs can be a little tough on the liver, and with very long-term use, there's a small risk of changes happening inside the bone marrow itself. But the most obvious danger? Making that repair crew too good at its job, which leads to way too many platelets and a much higher risk of forming unwanted blood clots.
And this right here brings us to the most important theme of our entire tour of this factory. With all of these incredibly powerful tools at our disposal, we come face to face with a really delicate balancing act. It is never, ever just about making more. It's about making the right amount.
This slide really illustrates the core dilemma perfectly. On one hand, yes, we absolutely want to boost red blood cells to fight that crushing fatigue from anemia.
That's the goal. But on the other hand, if we push that production too hard, the blood can become too thick, dramatically increasing the risk of a life-threatening stroke or heart attack. It's a constant tightrope walk.
Or just take iron, for example. It is absolutely essential for our oxygen carriers. But for patients who need blood transfusion after blood transfusion, that iron starts to build up in their body, and eventually it becomes toxic, damaging vital organs like the liver and the heart. So we actually need a whole other class of drugs called chelators just to go in and safely pull that excess iron out. It just goes to show you even a good thing can be dangerous.
So, as we wrap up our tour of this amazing internal factory, what are the big takeaways from the factory floor? What have we really learned about managing our body's all-star team?
You know, it really boils down to this. We have 3 incredible teams working for us around the clock. We've got the oxygen carriers delivering fuel, the immune defenders providing security, and the clotting crew handling all the repairs. And the most important lesson is that for every single powerful therapy we use to help them, we have to remember that delicate balancing act between the benefits we're hoping for and the risks we have to manage.
Which leaves us with one final fascinating thought. I mean, we've gone from just supplementing raw materials to being able to precisely control the factory's output. So, as our control over our own biology gets even more precise, what's the next frontier? Are we going to be designing custom blood cells from scratch? Or maybe even editing the factory's own genetic blueprints? The future of building a better bloodstream? Well, it's really just getting started.